The first day of December and thoughts turn to Christmas. But how much will we be celebrating? After a top government medic suggested we limit our socialising, the government said, no, please don't change your plans. And if you want to have as normal a Christmas as possible, they say, get the booster.
I think people should really see this as a national mission. We've all got a role to play in this, not just the NHS. We've all got a role. And if anyone receives a call, a message from the NHS asking them offering them the vaccine, then please can I say to them they should step up and roll up their sleeves and get protected.
Dr. Ralph Genter is on the front line in Rayleigh and Essex, wondering how he's going to make this expanded vaccine programme work.
It's not just a case of more money, because the staff who can actually do this are very much exhausted. Not sure how we're going to do this, but last year I wasn't quite sure how we would do it in the first place, so I'm sure we will get it done somehow.
Some are finding it's taking a while to get an appointment for a jab. The official advice remains wait for the NHS to get in touch, even for a walk-in centre.
Tried coming here on Sunday, it was queued up out down the road, I think, with all the new rush going on with the new virus. So we come along, it's about 10, 15 deep, so not good cure, so it's better coming along, booking it through the doctor.
Actually was having a previous physio appointment, and I asked then if I was eligible for the booster jab, and they booked me straight in. So literally it was within less than a week.
1,500 pharmacies will be part of the new rollout. Pharmacists say they'll be crucial.
I think this needs community pharmacy because we are so vital in helping tackle health inequalities. We are trusted. People know that if they've got concerns about vaccines, that we will talk to them and have a trusted conversation with them. And we can do this en masse because we're small and agile. We're within 20 minutes of most people.
Today, the World Health Organization said most cases of the Omicron variant had been mild. Here, the government says we'll have to wait 3 weeks before we have a really good idea of what it is we're dealing with. And in the meantime, they say if we want more of this, we need to be doing more of this.
To Andy, who's in Downing Street for us now. Andy, some busy scenes behind you. What's going on?
Well, Sean, they're about to switch on the Christmas lights here, but it's events, or alleged events, last Christmas which are causing a bit of trouble this evening, with the Daily Mirror reporting there were 2 parties on November the 27th and December the 18th inside Downing Street, which, if that really were the case, that would have meant that probably COVID rules against indoor socialising and mixing of households would have been broken. Certainly the Labour leader thought it was significant enough to bring it up with the Prime Minister today at Prime Minister's Questions.
As millions of people were locked down last year, was a Christmas party thrown in Downing Street for dozens of people on December the 18th?
All guidance was followed completely during number 10, but since he asked about what we're asking the country to do this year, Mr. Speaker, which I think is frankly a more relevant consideration.
Well, some have noted that the Prime Minister didn't say there were no parties, but he did say all guidance was followed, and certainly government sources after Prime Minister's questions were saying that they didn't recognise the account that had been given in the newspaper. So, disagreement, a degree of controversy there, but it has allowed Labour and the Scottish National Party today to try and maintain this line of attack that there's one rule for Downing Street and one rule for everybody else. But right now, as you can see, they're getting ready to switch on the Christmas lights and have a friendly outdoor party this evening.
If they do, it'd be nice to see it. All right, for the moment, Andy, thank you.